Hi, I'm David Green, CEO of the Florida Pain Network. Today the topic Hi, I'm David Green, CEO of the Florida Pain Network, where we connect those in pain with the best pain relievers throughout the state. That includes pain management clinics and doctors, physical therapy practices, and chiropractors. Today the topic is epidural steroid injections. What are they? How well do they work? Who should get them? Well, at any one point in time in the United States, 1% of the population is suffering from sciatica. That's a large number. When you have over 300 million Americans, 1% is over 3 million Americans every day are suffering from sciatica. Well, the sciatic nerve is a real name for a nerve, but it's actually made up of multiple nerve roots that come out of the spine and come together and form the sciatic nerve. Then you have one in your right leg, one in your left leg. So the nerve roots that make up that sciatic nerve can get pinched from a disc herniation. Brought a visual aid. This is a disc and it's fairly round. There's one at every level of the spine and it's between the levels. So if you have an L5-S1 disc herniation, it's affecting the disc at L5-S1. That's why it's called, whatever levels it connects. Okay, it's squishy, and I like to analogize it to a jelly donut. So if you have a jelly donut, and I get hungry every time I do this video, and you have a tear in the outer part of the donut, some jelly can squeeze out, and that's what I've shown here with the arrow. And the question is, does it touch anything when it comes out? If there's a nerve root coming by and it hits it right here, that can cause a pinched nerve leading to sciatica. Now, usually what happens is the disc comes out, it pinches on that nerve, and it leads to inflammation. So when you have sciatica, that means inflammation of the sciatic nerve. So that's depicted here. An epidural injection can put steroid medication in this area to help decrease that inflammation. And that can work really well too. It's usually done as an outpatient. Doctor does it in a surgery center under fluoroscopy, which is a real-time x-ray machine. It really should be done under fluoroscopy. Doctors used to do it years and years ago in their offices, just kind of put the needle in and hope they were in the right place. 40% of the time, they missed. Studies have shown that. So it is best to have it done in a surgery center with a fluoroscopy machine with a pain doctor. Okay? So when the injection is done as an outpatient, this is the spinal cord, okay, or the remnant of the spinal cord, and these are the nerve roots coming off. And you have one on the right, one on the left at each level, all right? So if a disc is pushing on a nerve root here, that can cause the sciatica. And what a pain doctor will do is inject numbing medication and some steroid in this specific area. So it puts a proverbial Band-Aid on the situation. It doesn't fix the problem. That would be surgery. This doesn't fix it, okay? But it can give a nice Band-Aid, and they've been shown to work well over 75% of the time. A recent study actually showed in professional football players, they worked well 89% of the time. And athletes got pain relief and they were able to get back to playing professional football. Very impressive, okay? It may take one injection, it may take two, it may take a full series of 3 injections. And those can be repeated every few months. All right? So, 2 questions that we get frequently, our doctors. One is it going to fix the problem? Like I said, the answer is no, it's a big Band-Aid. Hopefully that piece of disc will get disintegrated. Your body knows it's not supposed to be there, but sometimes it does get rid of it, sometimes it doesn't. Okay? That's the first question. Second question is how well do they work? And as I mentioned, 75 to 90% of the time get excellent pain relief. And then it's just a smattering of other questions, such as how often can these be done? And that's debatable. Some pain doctors will do them once a year, a whole series. Some will do them 3 times a year. It's debatable. Also according to how much the symptoms come back. Patients who went on to have surgery with a herniated disc, studies have shown that at the 1-year point, the results of non-operative treatment were equivalent to those who did have surgery. So the best option is if you can avoid it at all possible, sure. Now, if you have a foot drop or you have some other issues like bowel and bladder That's more of a surgical indication. I'm not talking about that. I'm just talking about sciatica pain. So there you go. There's a lot of information on our website at floridapainnetwork.com. Check out our active blog there. A lot of education on the pages, and then an active YouTube channel too. If you're in pain and looking for help, type in your city or your zip code, and there's a Google map geo-targeted listings of providers close to you. It shows you the insurance information, the services provided, and a lot of things are there. Great. I'm David Green, Florida Pain Network. Your pain stops here.